Are you saying, therefore, Professor, this lockdown, lockdown, unlock, relock is simply part of this process?
No, it's only because as a country, we have two issues. One is that we don't have the ability to constantly socially distance like maybe the Singaporeans do or the South Koreans do, because a structure of our population is not like that. So we can only go on fourth gear, or we can come to a complete stop. So we choose between these fourth gear full speed versus complete stop. Now, if we had the option of going at first or second gear, that would be the ideal, but we don't have that option. But that said, let me also tell you that at least from what we've seen from other countries, lockdowns are effective at very early stages in the epidemic, like India did at the outset. Then they're very effective. Lockdowns are not very effective in crowded populations when the disease is already taken off. So even if you have a 1-week lockdown now, I don't think it makes a huge difference in terms of what you buy with the pain and suffering that goes with such a lockdown.
That's a very important point, Dr. Parikh, which is just being made by Dr. Lakshmi Narayan, that the initial lockdown has an impact. It slows down the progress of the curve, gives you time to prepare. Now the lockdowns of the kind that Mumbai has just announced for another 4 weeks, other states are announcing, perhaps may be subject to diminishing returns. Because people are already going, you want people to go out there, do business, and at the same time you want a lockdown. You can't be in second gear, either you've got to be in first gear or fourth gear. Okay, we are having a problem. We're having a problem with your audio, Dr. Parikh. We'll try and come back to you in just a moment. Can you hear me? Yeah, go ahead.
Okay, so first of all, I am in near complete consensus with both Dr. Vinod Paul and Dr. Lakshmi Narayan.
Yes.
Specifically in answer to your question that, we have to choose between the first and the fourth. I'm not entirely in concurrence with that observation. I think a key element of the strategy has to be flexibility. We have to be able to opt to shift gears as we go along. And, you have the war metaphor right up there when you're talking of a battle plan. And I think battles that have succeeded, whether it's been Alexander or Napoleon or Julius Caesar, their great strategy has been flexibility. However, there is a very important integral difference between a battle against a country and a battle against a virus. In the first, secrecy is an integral part of that battle. You can't put your plans out there. But in the second, historians, medical historians such as Howard Markle and others have pointed out time and again that transparency or a lack of secrecy has to be an integral component when you're battling a pandemic. Almost always, secrecy has contributed to the spread of a pandemic and has hindered public health campaign. This is Howard Markle talking. And the third thing, which I think is important, is in this plan, it has to be multidisciplinary. The medical people have to take a back seat. Well, it was largely a mathematical projection in the beginning. The medical people came in. Now, of course, the economists and the sociologists and political people need to come in. You need to have a multidisciplinary, highly flexible and highly transparent plan.
But let's get specific about it, Dr. Paul. The re-lockdown, for example, take Hyderabad, a city which is likely to go into re-lockdown, we are told any time now. What does that really do, in a sense, to the city's character? I mean, do you believe that's the solution, that every month you sort of are flexible enough to decide, this month I'm going to unlock down, I'm going to unlock, next month I'm going to relock? Does that work? Can you have this constant unlock, relock system? Is that the only way, Dr. Paul, you think? Or do you focus only on the containment zones?
Rajdeep, we must remember that there is no standard operating procedure or a rule book for this particular pandemic. Every country, every city has been learning, how to deal with it. And it's always a mix of options that you exercise, as you move along. Of course, we now have advantage of learning from others' experience and also a huge amount of our own experience. I would say on the specific point that you are raising, I think a city or a state or a district may decide to go for an option of significant restrictions, even amounting to a lockdown, if the need so arises. What would that mean? it would mean that the number of cases are now surging in such a manner that I can foresee that 10 days from now, 20 days from now, or even 5 days from now, the number of sick individuals may be too high for the health system to tackle. Now, that's an obvious situation where something very drastic needs to be taken. One approach is, can we augment the capacity of the health system? Unfortunately, that does not happen so quickly, getting nurses, getting ICUs done. So there is a finite capacity of the health system that's available to us. When that appears to be breaching, we have to exercise the option that beyond a certain point, virus and its transmission is suppressed to the best possible extent by bringing the ultimate social distancing mode, namely what we know as a lockdown and a general lockdown.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.